I'm going to talk to you guys tonight about first aid when it comes to horses. Can you guys see that?
Yes, ma'am.
Okay, so one of the first things that I think is important for us to understand is that some people like to say that horses are suicidal. I don't necessarily love to say that because I think that when we domesticated horses and we moved them from, the open area to being in, stalls and being handled every day, I think we also have created a few things that have put horses more or less, literally in danger or not. Obviously, it has benefited horses as well because when they are, tended to the way that we do, they let me see they also get to be tended when something happens to them, and horses in the wild obviously don't get to be tended, and if something happens to them, they are not going to be tended to and they die. So that's one of the things that people say, oh my gosh, do I have to feed horses? How do horses in the wild do? Well, they die, they get eaten, they, you know what I mean, they die of starvation. So this is some of the things that people are like, when I don't necessarily love when people start comparing our horses, the domesticated horse, to horses in the wild, because literally there is no way to compare. However, when we started putting horses in enclosed areas, we have created a few things that may have been a problem. Okay, so I think first of all, it's important that for everybody that has horses to understand horse, the way that they think a little bit. So I don't think that they're suicidal, but they do have a fight or flight response that may be a little bit more exacerbated than other herbivores. So when they get stuck in a place, they actually fight more than maybe other herbivores will do. So I think that we need to understand that. And let me move my little guy here because I cannot see my slides. And always be prepared because, like I said, some horses will get themselves in trouble more often than other ones, but it's always good to be prepared. So about first aid, we're going to talk about several different things, but one of the things that I think is important for a horse owner to have is a good first aid kit. Okay, and I started typing a document, and I'm going to send later on. It's a Word document, and what you have in hand. So first of all, you need, if the horse is not yours or if the horse is yours, but you need to have the owner of the horse information at hand. You have to have your veterinarian, the farrier, all those emergency numbers, easy to assess. And when you move to a new place, so say if you have buy a new farm, it's also important to contact the fire department so they know where exactly you're located, and they can faster or more slowly get to your place. And it's important that you understand that too. For the first aid kit, obviously we're going to have some bandaging material, so some vet wrap, some 4x4 gauze. I put here sterile, some of them, if it's clean inside the box, it doesn't necessarily need to be sterile. Animal Intex for abscesses, elasticon, towels. I'm a big fan of towels. So those towels that you can buy big ones, but the ones that you buy at Walmart, like 10 towels for $3, those ones, they are really useful in cases of laceration. So they can, to compress the blood to stop the bleeding. And then diapers for abscesses of the foot. Diapers are wonderful, but I think it's important that we get the little swimmer diapers, because those ones don't get inflated with water. They don't soak in water, okay? Because the regular diaper becomes this big the next day if the horse is put outside in the grass. All the humidity in grass, the diaper becomes like this big, and that's not what we want. Okay, so we want the little swimmer so the hoof pack can maintain its form. Obviously, we need to have some medications also. So I put here some, wound spray. So there's Vetricin, There are some sprays that are toxic. I say that, I think it's the last slide that I have, what not to use. Triple antibiotic ointment, chlorhexidine solution, or betadine solution also. So those need to be diluted before we can actually use. So for betadine, for example, I like it to look like a weak iced tea. Okay, so you have to, ideally you are going to dilute it with saline, but you can dilute it with water as well. But just straight betadine to a wound will actually damage the wound. Okay, stethoscope, thermometer, hoof pick, latex gloves. Obviously, if you're allergic to latex, you're going to get something different. Duct tape, a flashlight with batteries, and also the batteries working and not totally dissolved inside the flashlight. Ask how I know. An eye mask, and I'm going to show you a photo. There is like new goggles for horses for eye injuries, and they are really, really good. Soft rides, farrier equipment, just to prepare for anything that may happen. A twitch is very important for people to have in hand so we can immobilize a horse. And then some medication. So you need to have a good relationship with your veterinarian so they can prescribe the medication so you can have at hand. So some medications are very important to have. So some sedatives, some Benamine, bute, and some antibiotics. It's important for us to talk about and learn how to do vital signs. So that's TPR, so temperature, pulse, and respiration. So I have in the next slide what we actually do too in photos. But we need to also know what's the normal for the horse. So like for pulse, which we can do like behind the eye, it's 35 to 45 beats per minute is normal for horses. If it's elevated, it's a sign of pain. A lot of the times colic. Excitement also, if it's elevated and it's super hot and the horse just came in from being exercised and is not the heart rate is not going down, it can be pain as well. Respiration rate, it's going to be anything like between 12 to 15 to 24. If a horse is breathing too much, it can also be like if the weather is not super hot and the horse didn't come back from exercising, it can be also a sign of pain. GI sound, so that's why we need a stethoscope, and we need to learn to get the GI sounds on the 4 quadrants on both sides of the horse, so we can, we should be able to hear sounds and movement happening there. And then digital pulse, we're going to get on the fetlock of the horse to see. And increased digital pulse it's a sign of pain or inflammation in the foot. So it's important that we understand how and know how to get the digital pulse when the horse doesn't have pain. And also when it's cold like this, we need to know that's going to be a little harder to get the digital pulse. And then when it's super hot, 100 degrees, it may be more, throbbing. And that may not be a sign of pain, especially if both feet are the same. But this is increased digital pulse is not just sign for laminitis. It can be abscess, for example. It can be other inflammation as well. And then obviously the mucosa, the gum color, needs to be pink, moist, and we do the capillary refill time, and it needs to be 2 seconds or less. And this is just some photos showing, like what a normal gum is supposed to look like, capillary refill time, a thermometer. I like to use the thermometer that's like 6 seconds, because when a horse is colicking and thrashing, you don't want to be behind him or, for more than that. So I think it's very important that those thermometers probably cost $10 as opposed to like $1.99. So, but I think it's important to have those. And then for pulse, we can do pulse here. We can also do behind the eye. Another thing that I think is important for everyone to know is how to restrain a horse. And the reason for that is because when a horse is agitated and has pain and a trauma has happened, he may not, it's not every horse, but he may be a little bit out of control. And especially if there is a wound involved, and then if you have to assess, the wound, you're going to have to keep him under control somehow. Okay, so there is different ways to restrain a horse. Obviously holding up one leg. So one person holds up a leg as the other one tries to do whatever. Obviously a horse that is in distress, they can pick up their leg back very easily. So you can do, a twitch, you can do a shank over the nose or a lip chain on the gum line. And that sometimes seems to, help agitated horses. I just saw the Thin Line, their brand Thin Line. I don't know if you guys know. They just put, so it's like very, very soft. So it's not a chain. It's a rubbery material. And you put here and you attach to the halter of the horse. And it's supposed to, and it calms the horse for the farrier, for example. So that's a way to restrain the horse as well. Obviously, a shoulder roll. I prefer the shoulder roll as opposed to like doing on the ear. On the ear, the ear is so sensitive. We don't want to, hurt the ear. Especially, it makes horses even more head shy, and a lot of horses are already head shy. And then obviously we have sedatives that are chemical restraint, and a lot of the times, depending on what has happened to the horse, we actually need that. So that's why when I said talk to your veterinarian so they can prescribe medication for you to have at hand, sedative is one of them, okay, for this particular reason. So you can have sedatives that are intramuscular or IV. You can also, let me see if I can mute this. And you can also have, like, dormocidin is one that you put sublingual. But it keeps the horse sedated for about 4 hours, that one, depending on how much you give. So it's sublingual. So it's something that if you are not comfortable giving an IV injection to a horse, that's something that can help you as well. On that subject, okay, when we talk about colic, I need to mention about Benamine and IV injections, okay? So now let's start with some of the emergencies. Now, I am not being able to see if there is anything on the chat. So if there is anything on the chat, any questions, somebody needs to tell me. So, but if you have questions, don't hesitate to maybe like lift, I don't know, do something, maybe unmute yourself and ask questions. You can ask whenever you want, okay?
I'll watch the questions, Dr. Camargo.
Sounds good, thank you, thank you. So, ocular emergencies, eyes. And this is one of the things that is probably one of the pet peeves of mine. And I want you guys to annotate that in your heart and in your brains. Eyes are always an emergency, okay? Eyes are always an emergency because a horse can become blind easily, okay? So if you see them squinting like this, and if you see swelling in their eyes, if you see, it's always an emergency, okay? So if you have Neopolybac eye ointment at home and you can apply some, that's great. But that's still, the veterinarian still needs to come and take a look to see what's happening to the eye. If you have a corneal ulcer, there is this disease called melting cornea, melting ulcer. I don't know if you guys have seen that, but it's a fungal infection of the eye, and the cornea literally melts, and it's terrible, okay? So you don't want to get to that point. But clinical signs of eye emergency, so swollen eyelids, you can have a lot of discharge, squinting, there is a lot of pain. I don't know if anybody here has hurt their eye before. It's very, very painful, okay, for the horse. So it is something that you need to tend to kind of quickly. It needs to be seen as soon as possible because it can be, like I said, it can be ulcers, uveitis. Uveitis is the inflammation, sometimes infection in the back of the eye. The fungal infection is what I was telling you about. And then obviously lacerations is something that, can happen, especially when horses are around hardware, okay? If you can give this horse, some, and if you have Benamine at hand, you can give it IV, or you can give it if you have paste, or if you have, some people give the injectable Benamine via mouth. It just tastes so disgusting. I don't know how people can do that. But it's something that and Benamine is the medication of choice for eye. And then The treatment, you are going to have to put whatever treatment it is. Sometimes it's the triple antibiotic ointment for eye, so like the little tubes of eye. One of the things that I like to do, so I don't keep contaminating the tube of eye ointment, I get one of those 1 ml syringes, like the insulin syringes, and you can put a tiny amount there, and then you apply with the syringe to the horse's eye. And one of the things that is important is that the veterinarian needs to come and see what's happening. If it's just an ulcer, if it's going to be treated just with antibiotics, Benamine, possibly also, or if there's going to be other medications that will have to be applied. The melting cornea, okay? So this, that is by that fungal infection, it needs to be tended to every 2 hours, okay? So that is a pain to treat. And a lot of the times we will have to apply what we call the subpalpebral lavage system, which a lot of horses, because it hurts so much to actually tend to an eye, which we have the lameness reflex, we are not born with it, but we develop this lameness reflex to protect our eyes at all costs. To have somebody just come in with medication inside your eye every 2 hours or every 6 hours, some horses just don't accept that. So you have to install the lavage system, which is a little tube, as you can see here, that goes all the way, we tie to the mane of the horse, and then you're going to be applying medication over here, okay? So you can actually lavage the eye with saline, and you can apply medication that way. That way, the horse, you're not getting too close to the eye of the horse, and it's more comfortable for him. I know it looks a little weird, but this is actually more comfortable for the horse than to have somebody come to his eye, especially every 2 hours. Now, if it is that, you know, the melting cornea, one of the things that we recommend is that the horse stays in the hospital, because it's very seldom that an owner is not just dedicated, but has the time and the ability to actually go and do this every 2 hours for like a week, 2 weeks, 3 weeks, a month, okay? So it is, as sad as it is, after a week, sometimes it goes every 4 hours, and then after another week, it can go after 8 hours, so that at that time, the horse can come back home. And these are the goggles that I was talking to you about, because fly masks will help too. Because when the horse has anything with the eye, it becomes very light sensitive. So those UV fly masks will help, but it can also catch, okay? So especially in the case of a laceration, if you had to stitch the eye, it can catch on the fly mask, and then it can actually rub, you know, it can become a little bit more of a mess. So there are these things, and this little girl here is a little 4-H'er in the making. Her mom used to be a 4-H'er in our program, and she is obviously being raised the right way. And you guys can see this horse here, it's an Appaloosa, and he's always a little bit semi-blind. So he actually uses this to be ridden. This can also be used for medication when the horse has a problem with the eye, but also this particular one is actually sunglasses for horses that have a problem with the light. And it can also be used to protect the eye. And then the other ones, this one has UV protection, so it's darker. And this one here, as you can see, it's hard plastic, so it stays very, very much away from the eye. And the reason why I like this guy here is because you can actually see the eye and what's happening, so you don't have to necessarily to remove, because with a fly mask, you have to remove it to see, what surprise you're going to have under that fly mask with the eye being treated, if there was any tension in the sutures, etc. With this one, you actually can lower your blood pressure as you approach the horse, and you can see that the eye is doing well. If you guys have any questions, like I said, don't hesitate, okay? And I know I talk fast, but I want to be able to get over everything. Another emergency is colic, okay? So colic is something that the GI tract of the horse will lend horses to actually colic. The GI tract is so long, so gigantic. Hold on. Not only that, but it has some curves, okay? and what we call flexures. And it also goes from like large places to smaller places, especially in these flexures. And that's when a problem can happen, because you can have impaction in these areas. Now, there are colics that are medically treated and colics that are surgically treated. So one of the things for us to see about colic is that, like for example, impactions are generally medically treated. You have to hyperhydrate this horse to try to soften that impaction. But sometimes you actually have to open the horse up to actually remove, okay? So the thing about colic, and this is what I said about Benamine, is that one of the cardinal signs for us to see if this horse, if this colic needs to be taken from being treated medically to the surgical table, is how the horse responds to treatment, okay? And part of the treatment is to give Benamine and xylazine, okay? So the way that the horse responds, if the horse has like a, high heart rate, is rolling, it's looking at his flanks, it's biting, and then you give the Benamine and the horse calms down, the heart rate goes down, that's a good sign. A horse that has like a twisted gut inside him, it's not, Benamine is not going to help much, okay? However, one of the things about this is that we need to give Benamine IV in this case, okay? Why is that? Because one of the signs, if the horse needs to be taken to surgery, is how he responds to Benamine, and that generally with the IV is about 20 minutes, okay? If the owner gives Benamine to the horse orally, generally takes about an hour to 2 hours for an oral medication to actually have its maximum effect. So that becomes a problem, because now the vet arrives and the vet cannot give another dose of Benamine, because we can risk causing kidney failure. So we can't just give more Benamine after the oral Benamine. So I need you all, any horse owner, to learn how to give an IV injection. Now, there is problems too, because if you hit the artery, you can actually kill the horse, okay? So, but it's important that you know how to give an IV injection for this particular reason. So if you have Benamine at hand, to give to the horse as you wait for the vet to arrive. The vet arrives and you're gonna say, I gave Benamine at 5:30, it is now 6:15 and his heart rate is still not well, or, and then we're going to assess the horse that way, okay? So signs of colic, we're gonna have, flank watching, rolling, pawing, thrashing. I think one of the things too is be very careful. A horse that's thrashing, you don't want to put yourself in danger, okay? So it's important that we understand that your life is more important than the horse's life. So do not get yourself in danger when the horse is thrashing. So sometimes the best place for a horse to be, especially if he is being like that, like throwing himself, you may need to walk the horse a little bit, okay, until he relaxes again. So if a horse is thrashing, being inside his stall is probably not the best for him, because he can get himself in more trouble that way. Now I put here, should we walk the horse? And I just said that if the horse is thrashing, we probably should, okay, but not over walk the horse, okay? Walking a horse for an hour, 2 hours, 3 hours, you're exhausting the horse. So this is a horse that may need to go to surgery. This is a horse that needs every ounce of energy to try to recuperate whatever is happening with him. And when we walk him, and I think owners need to distract themselves, and they start walking this horse, and it's just exhausting for the horse. So if the horse is quiet and is not thrashing, it is not wanting to, if the horse wants to lay down, let him lay down. If he's laying down and thrashing, then we can walk. If he's just laying down quietly, we want him to lay down, okay? So do not keep walking this horse to not use up every ounce of energy he has, okay? I put here, get him out in an open area, not on asphalt, so he doesn't slip, so it doesn't become a dangerous situation for everybody. Lacerations. Lacerations are cuts, okay? And you may have like a tiny cut or you can have bigger cuts. And we're gonna see some photos in the end. But what do we do in case of laceration? So it is going to depend on the location. It is what needs to happen. It is also going to depend if it's still actively bleeding or if it isn't bleeding anymore, okay? So one of the things, the lacerations, so one of the main things that we need to do is if it's still bleeding, we need to help compress it to stop the bleeding. So that is the number one thing that you need to do. And that's where the towels come in so handy. So if it is, you know, like this guy here, you put towels on him. This is a difficult location to actually, you can maybe do vet wrap around and you can actually press with your hand. If it is here, you can do the towels and then do combined cotton is another good thing too. And you continue to add, if you continue to see frank blood coming through the towel or the combined cotton, you just add more. You don't remove to put new ones. You just add more around it, okay, until it stops. So that it's one of the most important things to do in case of lacerations. Now, if you find your horse, you know, like this or like this or like this, it's not actively bleeding anymore. This needs to be stitched, okay? So this needs to be sutured. Call the vet instead of adding products to it, okay? A lot of products that we may have at hand will prevent us from being able to stitch, to suture this laceration. So one of the things that come to my mind, some people use hydrogen peroxide and you put hydrogen peroxide on this, you effectively kill some good viable tissue right there. Okay, now hydrogen peroxide has its use in horse ownership, and that's for puncture wounds. For puncture wounds, you need to shove hydrogen peroxide in. Okay, but for lacerations like this, it's very important that, especially if it's clean like this, that you call the vet as soon as you can. Generally speaking, lacerations can be very well sutured if it's within the first 6 hours and they're not like full of manure or debris, okay? But even if they are, the vet is going to try to clean as much as they can and still try to suture part of it and maybe leave some part open because to drain, because covering it, even if it's going to dehisce, even if it's going to like come undone, will protect the new tissue, even if it's just for a week or two before it opens up again, okay? So that's important. One of the things to know is arterial versus venous blood. So arterial bleeding, it's going to be squirting with a pulse, okay? And that's harder to actually compress. And venous blood is just like dripping, is like a regular stream of dripping, and that's most of the times easier to compress, okay? So yeah, that's why I say here, both are going to need pressure, but arterial is going to need longer compression, especially depending on location and the size of the artery that got ruptured, okay? So this is a friend of mine, and this horse, Dr. Combe, this horse was in Canada, okay? And this horse is like minus 1,000,000 degrees right now. And that is terrible because when it's that cold, wounds take longer to heal because to heal, wounds are going to need blood, okay? And when it's cold, the surface areas, the blood goes away from the surface, okay? So this happened, they are thinking on a fence, and you can see, you know, you have multiple different muscle groups that are exposed. And I think she did a phenomenal job trying to cover. So one of the things that I think also I judge veterinarians is how well they actually clip the area. Okay, clipping the area is a skill that is important to have because that hair is dirty and is going to impede good healing. Okay, so when they clip the area, you can cover with a gauze or anything so hair doesn't go inside the wound, because if you guys know, hair on this wound here will never come out, okay? But you clip the area and then you try to salvage as much tissue as you possibly can. So I think that that's one of them. Some people look at this and say, it's so extensive, it's been more than 6 hours, let's just cut this off and, you know, and pray to God. This is not how it's done. So covering it is actually better for the wound healing. And as you can see, they added drains because there's going to be liquid being formed inside this wound. So it's important to drain so you don't form like an abscess because all that exudate can lead to bacterial infection also, okay? And this horse is going to be receiving Benamine. This horse is going to be receiving antibiotics. And then one of the things that's hard about a wound like this is that how do you keep this covered, right? Because if you just put things on it, I mean, you can't vet wrap the entire horse in elasticon. I mean, it just doesn't stay. So there is linkies that you can use for horses. But one of the things that I think is interesting is this is called like tie over. And you just tie some ropes and like with stitches, okay, on the horse. And then you put, this is the combined cotton. And then because that way you can add whatever Manuka honey or the SSD cream, and you can put, and then you can put the combined cotton and prevent more injury to happen to the wound. And you can maintain the wound very clean. So a wound to be able to heal needs to be free of infection, needs to be free of debris, you know, dirt, foreign bodies. It needs to be kept moist. And this is why, you know, I said like in the cold, it's hard to keep that area moist. But this is why I love the tie over because you can actually keep the medication on the wound to keep a good moist and good temperature environment for the wound to heal. So I think that that's super cool. The other thing too that I think everybody needs to learn to do is to do bandages, okay? And you need to practice this when the horse is not injured. So bandages, you need pillows or quilts and a good bandage so you can, you know, when horses, a lot of the times if they need to be put in a stall, they may need to be bandaged also to prevent them from stocking up. So these photos here I got from a group on Facebook that I'm part of. It's called Equine Vet to Vet. And if you guys can see, wood, a plank of wood was here. Look at this. This is a 4x4. Okay. And look at them. They actually put towels to prevent, to try to compress and do the bleeding. This horse here is the same. Okay. And you all can see this obviously needs surgery. So what you do, you find your horse like this. I mean, first of all, pray that you never find your horse like this. And then, but if you do, you put the towel there and you somebody else start hooking up the trailer to the truck because this horse needs to go to a hospital. You do not remove that, okay? The amount of splinters that something like this can leave behind, it needs to be opened up when the horse is fully like under anesthesia, general anesthesia, okay? And like here, the little slinky will work. So not all the slinkies will work, but this particular model does. And one of the things that is, like I said, is common, especially on like a weather like this, when the ground is treacherous and hard and there is ice everywhere. This is a common injury. So it's heel bulb laceration. And again, you need to compress. Do you see this? Those bubbles there, this is the same hoof, by the way. Those bubbles there, like that's air and that's active, like bleeding still. So, okay, so you need to compress it first thing and then call the veterinarian to see what's going to be done for this. Okay, a lot of the times they're not going to be stitched. It's hard. The skin doesn't, you know, doesn't approach, doesn't get close to each other very well in that area. but we have to, apply pressure. We're going to bandage this hoof, and it's something that's going to be done for a long, long time. And this is why I put here, if bandage has, frank blood, do not remove the bandage, just continue to add more and more layers on top of it, okay? This needs to be kept bandaged for a long time because it's so close to the ground. I mean, it's on the ground. Manure can get in there, urine and dirt and everything. And if this thing gets infected, it can take a long, long time. And I'm going to show you guys a photo, a series of photos. So this was about, so the horse had this heel laceration. He has one here too. And this was about 3 weeks after the laceration, but the owner didn't continue to wrap it. And the legs of horses are so prone to developing proud flesh. So it just started to become a lot out of control. And look at this thing. And there was another photo that was even nastier than this. And I just did an ad. But what happened to this horse, they went in and actually excised everything. They went to surgery and removed this entire thing and started from zero. And the horse looks to be doing really well. But this is something that looked like this. If kept clean and kept, wouldn't have turned most likely to this. It's just that the body starts to respond by adding more flesh to, this wound when it's contaminated, when it's not well taken care of. The whole bulb was removed. Look at this thing. Okay, so this goes back again. Like, does the hoof even regenerate? Does it even grow? It does. Okay, and that's the thing. It does. It is going to take a while, okay, for this hoof to look normal again. So again, you are going to need to be learning how to wrap feet very, very well, okay, and keep it bandaged and closed up. Now, can this horse go outside for the first few days? Probably not, but as no horse likes to be inside all the time. So you may want to do like with panels, with like corral panels, and then do like an outside stall for him. And then slowly you can turn him out, okay? I put here abscesses as a form of emergency because when horses have abscess, a lot of the times they are not bearing weight on that leg. So they are literally three-legged lame. And the problem is there's two things that can do that to horses. One, it can be a fracture. He can have actually a broken leg. And the other one is abscess. Abscess is not a problem most of the time. But if the limb is actually fractured, you need to obviously have it radiographed so you know what's going on and what the line of treatment is going to be. So abscesses is the most common form of lameness for horses. And I think it's important, it can be evaluated by a farrier. If you have one of those hoof testers, you can try to test it yourself. But it's important to see if it's not a fracture, okay? I put here hoof packing is very important, as well as soaking, okay? A lot of the times, depending on the horse, he doesn't like to be soaked, so then don't fight with the horse. So just do the hoof packing. So what I like to do for abscesses, you can do Epsom salts, like to soak. You can do, I think it's called Clean Tracks. It's an excellent one, but so expensive. My favorite one is animal Lintex. So you get the animal Lintex, you cut the right size, and you have to, make it damp, make it wet. You put it on the foot, and then I like to put the little swimmer's diaper, and then vet wrap around, and then duct tape around. And the duct tape, and Dr. Coleman teaches how to make like the little duct tape on your leg, chun, 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 and then like this, and then you put it, and then duct tape everywhere. That needs to be changed every day, okay, if possible. So you actually are assessing what's happening all the time. And after the abscess comes out, you continue to wrap it so it can continue to drain until the hole closes a little bit, okay? A lot of the times when you have abscesses and you're wrapping the leg for so long, the whole hoof just becomes so soft and gummy. And so then you can start like putting dry, maybe not even the animal Lintex anymore, but just the diaper and the vet wrap and the duct tape to try to harden that hoof back again. You can also put betadine, just paint it to try to harden the hoof again. Generally, abscesses are not treated with antibiotics unless they spread to the leg and cause cellulitis. In that particular case, it needs to be treated with antibiotics as well as Benamine. The thing about abscesses is that you can give the horse a bute if he's lame, and if the abscess is there, it's not going to do anything. The bute is not going to do anything. So the horse will continue lame even after you give him bute. So here is just, soaking, and this, obviously this person doesn't do the way that I do. They just put the animal Lintex here, and then they just are putting the vet wrap around. I like to do the little swimmer diapers, and then the vet wrap, and then the duct tape. Now this is, everybody has these guys here or a bucket, and then some people, and this guys here this is my personal horse. This is one of those 5 liters IV fluid, like saline, and that's very tough plastic. And the beautiful thing about this is that you can put on the horse and leave it soaking for like an hour, go back home, cook dinner, go back there, remove it, and then put your hoof bandage, okay? In the case of my particular horse, he's so active that he like destroys these things. So this thing here, then after this happened, because it doesn't accept a bucket, I went to Tractor Supply and got this thing here. It literally lasted 7 minutes, okay? And then I just gave up, and I just do the animal Lintex with him. This here is also one of my horses, and this, the bucket, obviously she's a better creature than he is. She accepts the bucket and he doesn't. And this is, we're both a root and riddle. She, because of this, and I'm going to show on the next slide, and him because of an abscess. And you can see here the diaper and the vet wrap and the duct tape. And we both went there, and they were good to each other. But what happened to her is this thing right here. Can you guys see? So wood fence is wonderful, except it has a ton of nails, and these nails come undone every once in a while. So it's important that we look at our fences and try to, hammer back the nails, or just remove them and put new nails in. But she was just barely lame, and I went to look, and needless to say, it's not advisable to remove the nail yourself, because we need to see first if it needs to be a surgery or not. In my particular case, it was like 9 p.m. It was January. I called my vet, that is the podiatrist, and I was like, this is what's happened. He's like, can you just wash her hoof and then inject, betadine inside or hydrogen peroxide, wrap it real well, and then bring her first thing tomorrow morning. And this is what I did. And then when we put contrast, for some miracle, she was able to miss every important structure. But it's still a pain, and we had to wrap this thing for a long time. As I'm wrapping this thing for a long time and having to inject things into the hole, it can see how gummy it became. Like her whole hoof is so soft. And let me see if you guys can see this.
Oh.
It opened up so it started to communicate that. And I was just like, you gotta be kidding me, right? But she's okay now. This was over a year ago. And it's just like, it got to a point that I was just like, you know what? I'm gonna turn this thing out and pray to God and hope that everything will turn out okay. Removing a sprung shoe, that is an emergency, because if this shoe is nailed on and got sprung, it can actually cause problems to the horse. And that goes back to, and if Dr. Coleman is going to have like an equipment thing, I'm sure he's going to bring farrier equipment and tools, but you need to learn how to remove a shoe. So next time that you're a farrier, if you don't know how to do this yet, you need to actually learn how to remove a shoe, especially for emergencies. One of the things I didn't know is that when you are doing this thing here, you have to actually bring the shoe or the shoe puller towards the middle of the hoof. It removes the nails a little bit more clean. This, I think it's called crease nail puller, something like that. Correct me if I'm wrong, Dr. Coleman.
You're correct.
Okay, this is the best thing ever created, okay? Because it's the easiest one to remove nails. And, but anyway, this is important. And one of the things that I think is important too is for us to have some sort of training on how to help horses in when they find themselves in situations like this. Clearly, you cannot pick up the leg and remove from there. You can try to remove the shoe. You can try to, probably the best thing here is to cut the wire. And but this is the problem with shoes and stalls and wire, like goes back to domesticating horses. Okay. And anytime that there is a shoe that got lost in the field, guess what? Somebody needs to go find it. Okay, because lost shoes can cause horrible problems. Okay, it can be life-ending for a horse. So this is not something you want to find. This here, not that bad, but this guy here, very bad. Okay. Another emergency is fever. There is a fever now, I don't know if you know, going around, not just in Kentucky, but in Kentucky and Florida, it's going around in a lot of places that nobody actually knows what's happening. They think maybe a type of coronavirus, not the one that, you know, humans are getting, but these horses are not colicky, but they just have a lot of fever going on. And fever is always an emergency. So when you see that your horse is hot and in the absence of, like, he wasn't vaccinated yesterday, it can be a lot of things. If he's not sweating, so that's an emergency. And again, you may need to give him Benamine, but you may also need to call the vet to see what's going on, because some very serious diseases are going to cause fever in these horses. And then when a horse has fever and the horse is sick, it's important to give him some rest before we start exercising and going back to whatever it is that we were doing before. But the thing about fever, when they start having fever, they go off of feed, they go off of water, and then it can lead to colic, it can lead to other problems. So that's why it's important that we figure out what is causing the fever as soon as we can. Okay. I put here first aid while traveling. So like that list that I'm going to send. So you just, when traveling, you just need to take the exact same thing that you're going to carry in a kit, and maybe less quantities than what you're going to have at home. At home, you may keep it in a cabinet unless you board your horse. If you board your horse, you want to put like in a plastic tote in the tack room. So when there is an emergency, you can quickly grab your first aid kit and go take care of the horse. One of the things that I say here is that when traveling, we need to carry halters and lead ropes where? Inside the vehicle, okay? So not just in the tack room, not just attached to the horse inside the trailer. It needs to be inside your vehicle, because if there is an accident and the trailer flips, and the trailer happens to flip on the side of the tack room, and then you don't have access to a halter, to a lead rope or anything, it's a problem, okay? So that, I think, is very, very important. Safety first. There is, you know, firefighters a lot of the times are trained to deal with large horse, you know, entrapment, and they can come and help. This horse may need to be sedated or not, but a trailer accident is not something that we want to have. Okay, so how do we do to prevent? And here's the thing, I'm finishing here in the next couple of minutes, and this is just going to be not the nicest photos you guys are going to see, but it's important. How do we prevent? A lot of things cannot be prevented, but a lot of things can, okay? So cleanliness is very important around horses. So we can't leave just, you know, manure forks laying around, or the hay forks, which is like the, you know, with metal, or, you know, like gates with the boat, which we're going to see here soon. So, you know, so this thing here, this doesn't belong where horses are, because they, especially close to a gate, because this obviously is a gate area, they get agitated when it comes to a gate, and one will shove the other one towards that, and this is what happens. Okay, so how can I prevent this? You can prevent this, but once you do this, you need to cut this guy. Okay, whoever installed that fence didn't do a good job, especially if it's inside the field of the horse. So goes back again, cleanliness, okay, and neatness on things, on how to do things. Goes back to, yes, I understand. I had a nail in my own pasture that came obviously from a fence. It was an old nail. And there's probably more there right now, but every once in a while you need to go around your fence line to hammer nails, because eyes can get cut. We can have these kinds of lacerations all the time, okay, when we don't have a clean area. This guy here was in Colorado, and it was a metal barn structure thing that was just like hanging, not, and he went under and sliced himself. So how nice. But this here took hours to get done. However, do you guys see how this veterinarian didn't clip the area? It turned out, I think this is a beautifully done job, but it could have been clipped. But it's in Colorado. It was, fall, so it's getting cold. As you can see, they ended up at night. And sometimes, the whole ordeal lasted like about 7 hours. So it gets to a point that you also want the horse to have a break. Clips get clipped to noses all the time, okay? And how do I prevent this? Number one, like if you're blanketing your horse, the clip on the blanket needs to be towards the body of the horse and not towards the outside. One of my friends just had her horse with the clip to the outside. When she arrived at the stall, he had effectively clipped himself to the door of the stall somehow, okay? So clips need to always be turned inwards, okay? You see this thing here? Not okay, okay? Not okay. It needs to be turned inwards, okay? Because horses get that done to their noses all the time. This bucket here, what's wrong with this bucket other than there is ice? I need somebody to unmute themselves and tell me what's wrong with this bucket.
Is it hooks on the bucket, Dr. Camargo?
The hooks on the bucket. What should we have done? Read.
Probably should have turned those in, maybe, if possible, or crook them a little bit tighter.
No, this is a brand new bucket. So it's as tight as they come. But this is what we do. We put duct tape on them because horses will slice their noses or hook this to their noses all the time. So this even comes with like a little plastic thing, new bucket. So it's not just metal. They're thinking, it's protective. But what you need is actually duct tape on these things. And that prevents horses' noses being hooked to that. This obviously is a manure fork laying around. Horse gets out and then finds the manure fork. Okay, so this is just a nightmare. This was caused by wire. So wire in horses is never that wonderful of an idea, and especially if it gets cut, and then this here is barbed wire. Which I understand a lot of farms have wire fences, but then it's important that the fields are large, okay? So horses are not hanging out too close to the wire. And again, you need to make sure that you check your fence line at all times. So like if you think Texas has barbed wire everywhere and thousands of horses, okay? But also their fields are 10,000 acres, okay? Horses don't hang out around the fence. Most importantly, pieces of wire should not be just like laying around, okay? So I went to some farms a while back and there is like hardware everywhere. And I'm just like, oh my gosh, get your kids to like clean up all this hardware. So hardware is not laying around, is not okay around horses. And again, do you guys see all this? This is all flesh, all like overgrown, like that granulation tissue. This is an old injury. And then they're just like, they cannot figure out what's happening. When they took the x-ray, there is a piece of wire around. Now, this looks tightly put, so I don't know, if somebody actually did it on purpose or if somebody, or if this horse caught it somewhere. This obviously is hay net. If we're going to put hay nets in horses, we need to be able to, number one, have a knife to come and cut him out. And number two, the only reason this horse didn't die is because he's the quietest animal I've ever seen. This is an owner that had her horse here in my place, and she had this hay net hung too low. So we need to learn how to hang hay nets. It cannot be low because they will get themselves in trouble. Obviously, if there is something that horses can get themselves in trouble, they will. So how do we prevent? Like this thing here, this was a kick. The veterinarian came and removed all these three. They were all milk teeth. So we hope that the permanent teeth don't get problematic. The veterinarian did a good job fixing this. This picture here, and this is the last slide that I have. This picture here is a dead horse, okay? And the horse bled to death. And everybody's like, oh my gosh, this horse bled to death. Was it the blanket? I don't know. I don't think it was the blanket, but it just made me look closer. And there was like a big gash right over here. If we're gonna blanket horses, we need to learn how to blanket horses, okay? And we have videos that show how to blanket, but we need to put the straps correctly. And this particular strap was not correctly put on the horse, which just adds a layer of problems when it comes to horse ownership. We need to learn to do, because these things can get themselves in trouble. And now we add a blanket, which a lot of times, you know, it's so cold that we have to. So there is some products that are okay to put on wounds. Furosin there is not one single study that shows that furosin is good for open flesh. It's good to sweat a leg. Powders like Wonder Dust or Blue Coat that spray, those are very, very toxic to the wound and never good to use on horses' open flesh.